Welcome back to Inside Chlorpromazine, where we uncover the science behind chlorpromazine and its surprising connections to viral infections and even chronic diseases like long COVID. In the previous episodes, we discussed its impact on viral replication and autophagy. Today, we are going to explore an equally critical aspect that's inflammation. More specifically, how chlorpromazine might help modulate the inflammatory response during viral infections and post-viral syndromes. I'm once again joined by a guest, a microbiology researcher with deep expertise in cellular immunity and inflammation. Welcome, Chaitanya.
Thank you for having me. Inflammation is such a crucial part of how our body responds to infections. So, it's exciting to dive into how chlorpromazine might influence this process, especially in the context of viral infections and chronic conditions like COVID-19.
To start, let's define what we mean by inflammation. Why is it so important in the context of viral infection?
Inflammation is the body's natural response to injury or infection. When a virus enters the body, the immune system is activated, leading to an inflammatory response. This includes the release of pro inflammatory cytokines and immune cells to the site of infection to fight off the invader. However, inflammation, if left unchecked, can turn into a double edged sword. While it's essential for eliminating pathogens, chronic or excessive inflammation can lead to tissue damage and long term complications. This is often seen in conditions like COVID-19, long COVID, where the immune system remains hyperactive long after the virus is cleared, causing ongoing symptoms like fatigue, muscle pain, and cognitive issues.
Now, where does chlorpromazine come in? We know it's primarily an antipsychotic drug, but can it influence inflammation?
Yes, it's fascinating. Although chlorpromazine is traditionally used for psychotic disorders, it has also been observed to have an anti-inflammatory properties. It affects multiple signaling pathways involved in the inflammatory response. One of the primary mechanisms by which chlorpromazine can modulate inflammation is through its ability to block certain receptors and channels involved in inflammatory responses. Specifically, chlorpromazine inhibits histamine receptors, which are involved in promoting inflammation. So, by doing so, it may reduce the overall inflammatory burden in the body. Moreover, chlorpromazine has been shown to influence the NSKB pathway, a critical signaling pathway that regulates inflammation. So, by modulating this pathway, the chlorpromazine might prevent the excessive production of inflammatory cytokines that contribute to chronic inflammation.
In viral conditions like COVID-19, one of the most concerning issues is the cytokine storm, a severe immune response that leads to widespread inflammation. How might chlorpromazine help in this situation?
Exactly. The cytokine storm is a situation where the immune system goes into overdrive, releasing large amounts of inflammatory cytokines like TNF alpha, IL-6, and others. This uncontrolled inflammation can damage organs, particularly the lungs, and contribute to severe symptoms or even death. So, chlorpromazine might be able to modulate this response. By blocking certain receptors and pathways, it can reduce the levels of these pro inflammatory cytokines, preventing the immune system from ongoing into hyperdrive. Studies have suggested that drugs like chlorpromazine could help turn down the cytokine storm and potentially improve outcomes in the severe viral infections like COVID-19. This could be particularly useful in preventing the progression from mild illness to more severe conditions where inflammation is often the driving force behind complications.
Now, let's talk about long COVID, a condition that has affected millions of people around the world. One of the hallmark features of long COVID is chronic inflammation. Can chlorpromazine help in this context?
That's a really important question. Long COVID is thought to be partially driven by persistent inflammation that doesn't resolve even after the acute infection has passed. One of the most troubling aspects of long COVID is the continued activation of the immune system, even in the absence of the virus itself. This can lead to a wide range of symptoms, including fatigue, brain fog, joint pain, and more. Chlorpromazine's potential to modulate inflammation could play a key role here. If the drug can help reduce chronic inflammatory markers like IL-6 or TNF alpha, it might alleviate some of the symptoms that come with long COVID. So, however, as we mentioned before, this is still in an area of active research and more studies are needed to confirm its effectiveness.
While we are talking about inflammation, it's important to remember that the immune system needs to be carefully balanced. Too little inflammation and the virus could persist too much, and there could be severe tissue damage. How does chlorpromazine find this balance?
That's an excellent point. The immune system is incredibly complex, and finding the right balance between too much and too little inflammation is key. Chlorpromazine doesn't just shut down inflammation altogether. Instead, it seems to modulate the immune response, reducing the overactive cytokine release while still allowing for an effective immune defense. The drug's effect on certain receptors and enzymes allows it to lower excessive inflammation without completely suppressing the immune system's ability to fight infections. This is a delicate balance, and as we continue to explore chlorpromazine's role, we will need to determine the right dosage and timing to achieve the best therapeutic outcome.
Could chlorpromazine be used in combination with other drugs to improve its anti-inflammatory effect?
Definitely. In fact, combination therapies are often the key to achieving the best outcome. Chlorpromazine could be paired with steroid-sparing agents or immunomodulators that target different aspects of the inflammatory response. By combining it with drugs that reduce inflammation more specifically or target viral replication, we might be able to enhance overall efficacy while minimizing side effects. For example, pairing chlorpromazine with interleukin inhibitors or JK inhibitors might help target the cytokine storm in a more focused way. This could be a particularly useful approach in treating severe viral infections and even long COVID, where the goal is to reduce inflammation without compromising the immune system's ability to fight off any lineaging pathogens.
It's amazing to see how a drug like chlorpromazine, which was originally developed for mental health conditions, could have such wide-reaching effects in the realm of inflammation, especially in the context of viral infections and chronic conditions like long COVID. Thank you so much, Chaitanya, for your insights into how chlorpromazine could help modulate inflammation and reduce some of the chronic symptoms we see in post-viral syndromes. In the next episode, we'll be shifting gears and discussing chlorpromazine's neuroproductive properties. It's a topic that ties into both viral infections and chronic diseases, and I can't wait to dive deeper. Until next time, stay informed and thank you for tuning to Inside Chlorpromazine.